Зараз наша технічна служба запускає, скажімо так, колег з кабінету очікування в семінар, тому нам ще буквально там кілька хвилиночок потрібно технічно, бо велика черга є очікування.
В мене на екрані професор Фегерт підписаний як пані Ірина, а пані Ірина підписана як професор Фегерт. Це цікаво, мені таке подобається. Jörg, we are very happy to see you from the center of Kiev. I can see that in your title you are signed as Iryna, which I like, so to say. Something is funny about it, but we will correct it. I will ask our technical
guys. But I think that people will be able to make the distinction.
You never know. We will see what. You never know. We will see what happens. So before Iryna will start officially, let me check with my technical team if all the people are in from Zoom and everywhere. Хлопці, кажіть, в нас всі вже є чи ні? Чи може пані Ірина починати?
Кать, у нас там ще є 180 чоловік в залі очікування.
Добре, добре. Зараз ми всіх додаємо, потім пані Ірина почне, потім я буквально 2 слова і ми переходимо до основної частини.
Ми не будемо забирати багато часу на вступи, дамо можливість Йорку більше.
Так, зараз вони мені не кажуть нічого, а я не бачу, пані Ірина, що там відбувається. Ви бачите, скільки?
Ще трошки запускають. Так. Я думаю, там секунду буквально.
Ми, до речі, всім дуже дякуємо, хто приєднався прямо в реальному часі, бо зараз 7 година вечора. Тобто ми вам дуже вдячні, що ви обрали бути з нами в цей час. Є, Костя? Всі. Кажуть, що ще 20 людей. Jörg, we are waiting everybody, because the interest is so high that there is a big queue for people who are entering the Zoom chat. So we are waiting for the signal that everybody entered who wanted to see you online in the real time. Just a second. Є? Все, можемо починати. Пані Ірина, будь ласка.
Так, я думаю, що ми можемо починати. Колеги будуть доєднуватися якраз поки наші вступні слова. Так, хлопці, наша служба, даєте нам добро вже? Розпочинаємо, Кать, правда? Не чую я Катерину.
Так, розпочинаємо. Розпочинаємо.
Рухаємося. Отже, доброго вечора, наші шановні учасники і наші колеги, наші партнери, наші гості. Ми надзвичайно вдячні вам, що ви зібралися зараз в цей вечірній час. Не всюди є спокійна ситуація, тому насамперед хочемо звернути увагу, щоб ви знайшли собі зручні, безпечні місця, де ви зможете взяти участь в нашому проєкті. І сьогодні ми з великою радістю і приємністю вітаємо вас на відкритті цього унікального тренінгового проєкту, можемо так сказати. Це проєкт «Спеціалізовані послуги для дітей і підлітків у сфері ментального здоров'я». Проєкт є результатом плідної співпраці Координаційного центру з психічного здоров'я Кабінету міністрів України з Європейським товариством дитячої підліткової психіатрії, і проєкт дуже активно і ефективно підтримується Дитячим фондом ООН UNICEF, який представництвом, власне, в Україні. Хотіла би зазначити, що проєкт «Спеціалізовані послуги для дітей і підлітків у сфері ментального здоров'я» є частиною всеукраїнської програми ментального здоров'я «Ти як?». Програма ініційована першою леді України пані Оленою Зеленською. Наша програма спрямована на забезпечення високої якості доступних послуг у сфері психічного здоров'я для молодого покоління України, зокрема. І в рамках нашого проєкту провідні міжнародні експерти з дитячої психіатрії поділяться своїм досвідом, своїми знаннями, своїми рефлексіями через серію з нами, з нашою аудиторією українською, через серію таких навчальних вебінарів. Сьогодні ми відкриваємо проєкт одним з дуже активних лідерів нашого проєкту, нашим партнером, шановним колегою, професором Йоргом Міхаелем Фегертом, якого раді представити. Він є провідним німецьким психіатром, дитячим психіатром, психотерапевтом і, власне, президентом Європейського товариства дитячої і підліткової психіатрії. Доктор Фегерт поділиться з нами передовими практиками дитячої і підліткової психіатрії, які є в європейських країнах. І це унікальна можливість для кожного з нас ознайомитися, власне, з світовими тенденціями, обговорити, які новітні підходи можуть бути адаптовані і інтегровані у нашу професійну практику. Наша мета – забезпечити стале вдосконалення системи ментального здоров'я в Україні, дозволяючи нашим фахівцям отримувати і застосовувати найсучасніші знання, досвіди для ефективної підтримки наших дітей і наших підлітків. І, власне, проєкт є ключовим елементом цьому напрямку. Ми вважаємо, що це важливий крок до зміцнення національної системи допомоги нашим дітям і молоді. Ми дуже вдячні за участь всім, хто зареєструвався сьогодні, хто бере безпосередню участь в вебінарі, а в нас зареєструвалося біля 1000 учасників, і це і дитячі психіатри, і психіатри загальної практики, психологи, клінічні психологи, педіатри, менеджери медичні. Сподіваємося, що більшість з них зараз в процесі доєднання, що всім дозволяє безпекова ситуація доєднатися. І, звісно, що ми дуже вдячні професору Йоргу Фегерту за те, що маємо можливість спілкуватися. Ми зустрічалися вже в Берліні під час конференції міжнародної, постійні дискусії, в постійному спілкуванні онлайні. Дякуємо доктору Фегерту, що відгукнувся на наші запрошення і був одним з найбільш популярних спікерів під час проведення координаційним центром і представництвом ЮНІСЕФ в Україні нашої школи «Усвідомлене лідерство у сфері ментального здоров'я». Ми сподіваємося, що наші спільні зусилля і інтерес всіх учасників дозволять нам досягнути серйозних успіхів у покращенні ментального благополуччя і держави нашої всієї, і наших дітей зокрема. Дякуємо тим, хто приєднався сьогодні. Пане професоре, ще раз подяка, і дякуємо всім тим, хто доєднається до нас, тим, кому ви запросили, адже ваша роль у цьому процесі є надзвичайно велика. І я з приємністю передаю слово нашому партнеру Катерині Булавіновій, медичному експерту дитячого фонду ООН ЮНІСЕФ, для продовження нашої комунікації з нашими колегами в цьому проєкті. Прошу, Катя.
Доброго вечора всім. Я буквально 1 хвилинку часу займу. Ви отримали попередження про те, що це буде відбуватись з різних каналів. І, по-перше, з координаційного центру, і так буде і надалі, ви будете отримувати анонси таких подій від координаційного центру, від Національної служби здоров'я України, яка нам дуже допомогла. І всі ці відео будуть лежати як на Фейсбуці координаційного центру, так і на YouTube UNICEF, так і на YouTube-каналі доктора Булавінова. Зараз ви побачите QR-код, як туди підписатись. Дякую, хто підписався, і ви зможете з колегами поширити це. Також і тому, що люди дуже багато сидять в телеграм-каналах через безпекову ситуацію. Зараз ви побачите QR-код на мій телеграм-канал і також підписуйтесь на Ірину Володимирівну, в якої дуже зазвичай багато новин про все, що відбувається, в тому числі і про ці навчальні заходи. На цьому я зупинюся, і ми надаємо слово професору Фегерту, і дуже дякуємо, що він виділив свій вечірній час на цей вебінар. Прошу, професор Фегерт. Дякую.
Yes, thank you very much, Iryna Mykychak, for your very kind introduction. And as the president of ESCAP, I'm proud to bring together colleagues from all over Europe to do these presentations in the following month. It's one of the small things that we can do to support you in that very difficult situation of war. And I'm impressed by the fact that during war, you try to change the whole situation of mental health and mental health of young people in the Ukraine. And my colleagues and I, we are very, very, very willing to contribute everything we can do in this field. I try to share my slides, and I hope that you can see them. Can you see it? I will go to the presentation mode. Can you see the slides? Yeah?
Yes, now we can.
Okay, we are glad that
Okay.
we have CME points for all the sessions we organized. So you will get a certificate for every session to honor your preparedness to come in the evening to listen to us, dear participants. It's really a pleasure to see so many people present here under these conditions. And what I'm going to talk about today is a bit about the global youth mental health crisis, because we had end of August, beginning of September, a publication of the Lancet Psychiatry Commission on Youth Mental Health. Then I will talk a bit about the historical development of German child and adolescent psychiatry, just as an example that we also came from a completely different system and had to develop changes also after the reunification. And then the focus of my talk today will be adverse childhood experiences, and to inform you a bit about these experiences, because they are also important as a starting point for prevention and early intervention. And in the end, I will come to an outlook, and at the beginning, I will give you some more information about the European society and our activities. So why is mental health so important? Mental health is a prerequisite for participation in our societies, successful development from the birth and even from before. Mental health is important for our life satisfaction, and your campaign, How Are You?, brings it in very simple words. Every day it's important to see and hear from our neighbors, from our friends in our family, how are you? We know about the risks endangering mental health, and we know that mental health move along a continuum from well-being over stressful situations like the war situation you are forced to live in at the moment. And then severe permanent stress can lead to disorder. And therefore, we think that it's very, very important to have interventions and an agreement on interventions that can promote resilience and prevention, and to have focused interventions if there's really a disease or disorder that we have to treat. So the challenge in childhood is development, and we have to successfully fulfill developmental tasks. And it's important that all our interventions on any levels, in the school, in the community, and in treatment, contribute to the stabilization of self-esteem and to give a positive experience to the youngsters we work with and work for. Development can also lead to failure and problems. There's a risk of destabilization, of negative learning experiences, and so problems can accumulate and finally end up in psychiatric disorders that really need treatment. And we know very much about the general risks And we know that children living in poverty have a much higher risk to be disadvantaged in education and in health, in general health and in mental health. Children in institutional care are a high-risk group, and the larger the institutions are, usually the more burden of institutional care you find in these children. And there is a special group, I think, that needs special attention in Ukraine at the moment, is the war orphans placed in family care or in institutions. They are absolutely a high-risk group because of the loss of family members and of the risk of integration in a new institution. And we have those children that experience neglect, maltreatment, and other problems in their household. So our resilience or the coping with the stress of war is different if you come from a very caring family background, or if you come from a background where you already experienced adverse childhood experiences. And then we have the special problem of the abducted children, children with parents in the battlefield that have worries about their fathers and so on. So we have a lot of special risk groups in the current situation in Ukraine, as we have in many, many other countries. So therefore, my first statement is that it is very important to fight stigma. And I understood Kateryna and Iryna, we met several times and discussed that there is still a lot of stigma about psychiatry in Ukraine. And the only thing that helps is what we are doing today. It's awareness of mental health problems and creating mental health literacy, more knowledge in the common society and among the professionals about mental health problems, not only in psychiatrists, but also with family doctors and others. And I think a first form of awareness is something like that "How are you?" campaign in Ukraine, so that it is allowed to talk about your current situation, your feelings, your anxieties, and all the problems that might be present. And then we need really sound knowledge about the support of those affected with mental diseases, how we can organize help on the community level, and how to avoid chronification and participation deficits coming, for example, from avoidance and anxiety. So mental health literacy, more information about mental health is the key. And that's what we are aiming with that ESCAP webinar series with the support of UNICEF for Ukraine. So a short outlook. An Ukrainian colleague living in London for a long time, teaching at King's College, Professor Denis Ugrin, will be the next speaker. And he will talk about therapeutic assessment for young people with self-harm. Then another Italian colleague, but working in the UK, is Andrea Danese. He will talk about trauma and PTSD. And for special reasons in his service, he has to start his lecture at 5 o'clock our time, meaning 6 o'clock Kiev time. So there we have a change in the time schedule. Then Professor Paul Plena from the Medical University in Vienna will talk about self-harm, suicidality assessment, and acute care and treatment. And then Anne-Marie Rauberg-Christensen and Ukrainian colleague in her service, Dr. Kovalova, will talk about psychiatric emergency care for children and adolescents. And I don't see your faces, but they told me that perhaps they will register for the seminar to see the first edition of it. So if they are here, give them a warm welcome. They will talk to you at the beginning of December. And then we will have Professor Sven Bölte from the Karolinska in Sweden, who is an expert in autism, and he will talk about autism. Then Professor Tobias Banaszewski from Germany, talking about ADHD. Professor Christoph Korell, who works in the US and at the Charité Hospital in Berlin, who will talk about medication, the tolerability and efficacy of antipsychotics. And then I will try to give a summary and develop with you an outlook what we could do next. So that's our plan for the next half year. And I hope that it contributes a bit to that mental health awareness and mental health literacy. So I was impressed by a paper published end of August on the so-called youth mental health crisis. And the experts of this commission, you see the long list on that slide, they said that youth mental health worldwide is entering a dangerous phase, and there are mega trends that affect the mental well-being of young people in many, many countries. And among these factors was the Corona pandemic. And I remember that we talked about this during the meeting in Berlin, because it also, that was the start when then the war began in Ukraine, but you started not from a healthy position, but you just survived the Corona crisis that like everybody survived. So there was a first difficulty situation. And the war in Ukraine, for example, if you look at interviews of adolescents all over Europe, is something that impresses young people everywhere in Europe. And in the countries that are next to Ukraine, many of the young people have a lot of worries about a potential war, because at least in Western Europe, most of us believe there will be never a war again in Europe. What was crazy, but it's a completely change of the situation. Then you have the climate crisis, and this contributes that in many, many countries, young people have worries about their future. And these global megatrends have to be taken into account if we want to have a good response in our health systems. And another specific thing in child psychiatry is that psychiatric disorders start in age 10 to 25. That's the completely contrary to the somatic disorders that affect mostly elderly people, and we spend most of the money in medical care with old patients. But in psychiatry, the important developmental phase is between 10 and 25, and about 2/3 to 3/4 of all mental disorders start in this phase. And if you have a problem at that phase, there's a long risk for chronicity and also for societal costs and participation deficits in the society. And this slide shows that it was not only the Corona pandemic, but the increase of problems with anxiety, depression started in many countries during the last 10 to 15 years. So we have a worrisome group of adolescents that really cares about their future. And I like very much that slide from the same publication, because they show that many of our disorders start with a small bunch of symptoms. So we have micro phenomena, a little anxiety, some depressed mood. And then if you don't intervene at that phase, you can't stabilize these children. From distress, finally, a disorder arises. And the model is that we have to reach children as early as possible in this development to hinder a further development in a potentially chronic eating disorder, personality disorder, substance abuse disorder, mood disorder, or psychotic disorder. So it's about the organization of a health system. We need a first level of community care with prevention programs, yeah, like you have in Ukraine, and like the initiative of How Are You has this conception of very, very early prevention and talking about emotions, allowing to talk about emotions. Then we need lay support, peer support, community support as a next step, and organized help for children, for example, in schools as a secondary care step. And only in the tertiary care, we have that very specialized help that we offer in our clinics and departments for patients with full-blown disorders. And what was fascinating in that, to a German newspaper, is that these scientists who talked a lot about numbers and the risks and everything, it was a very scientific paper, at a moment say what is lacking to youth in Europe and worldwide are narratives that we have in all cultures of the young hero that leaves the family, that has to cope with problems, who is not always successful, who has perhaps the help of a mentor, and then finally, in the middle of the 20s, has found his way, has found a certain specialization, knows what he wants to do in life. And they say that with all the influences and the perfect pictures we have in the internet, many youth have a lot of expectations how they should be, and then they see their own anxieties, their depressions, and they are confronted with problems in self-esteem. And I think we should talk much more about development, and that development is not linear, but development means also to cope with very difficult situations. So there is an increased pressure on young people all over in Europe. We have to increase our awareness on mental health generally in Europe. And we have a central role as child and adolescent psychiatrists and psychotherapists to address this mental health crisis. And this goes beyond our medical profession in general. And therefore, I'm so happy that you are professionals from many different fields, and you are family physicians and all people that want to contribute to better situation in mental health in children. So the European Commission reacted to this situation, and they have a comprehensive approach to mental health. And in these papers, Ukraine is mentioned, and the support for mental health in Ukraine is also part of this paper. There was also a paper of the European Council and a paper of the European Parliament. So I think everybody is aware of the crisis, but still these are words. And now we have to come to action, really to support young people. Our society, ESCAP, the European Society for Child and Adolescent Psychiatry, drafted a position paper before the European Parliament election. You can download it here. And we said we urgently need actions now to address these current mental health crisis trends. And we urged the European Parliament to install a commissioner for children's rights, children's child protection and mental well-being to advise the Commission in these issues. Because often in politics, the perspective on the next generation, on our future, is forgotten if we deal with the big problems of the world. So we need a mental health in all policies approach. We have to think about what does a change in the school system or in different system, what does this make for self-esteem and mental health in children? And therefore, I'm really glad that you come from different perspectives. And we also published a paper on youth peer support workers. And I think youth supporting other youth are a very important element in supporting youth in this crisis. But also access to care and to medication is a big issue. And for the treatment of ADHD, Tobias Banaszewski will talk about this, methylphenidate and other stimulants are crucial in the treatment. And they are still not on the WHO list of essential medicines and neither on the EU list. So as a professional society, we urge the United Nations and the EU to mention these medications because in many countries, the access is only granted if medications are on this list. And finally, we contributed to a consultation of the European Parliament and we joined the Pan-European Mental Health Coalition as an initiative of the WHO. And in my presidential address, times marked by consecutive crisis, I described a bit this picture I gave you now. A short look at the historical development in Germany. We had first departments of child psychiatry in the 1920s. And then we had the Nazis from 1933 and the political use of psychiatry in Germany. And the foundation of the German Society of Child and Adolescent Psychiatry, and I'm sitting in the rooms of this society, was a political action during the war in 1940, and German doctors could come from the front to Vienna for this foundation. And our society had a historical project on this starting point in the Nazi Reich. And we just present at the Congress that we will have next week and where we will have visitors from Ukraine present a new work on all our honored former presidents of the society and their involvement during the Nazi periods. So we came from a neuropsychiatric tradition, very neurological. In Austria and Germany, there was also an educational tradition in child psychiatry. We had a psychodynamic, psychoanalytical tradition that was irradiated during the Nazi time. We had a more Anglo-Saxon empirical epidemiological tradition, and we had some sort of a social psychiatry tradition in some parts of child psychiatry. And it was very, very mixed. You see the rapid increase of child psychiatrists in Germany. And you see that we had discrete specialist physician for child and adolescent psychiatry in 68, and in 93, the specialist title changed to child and adolescent psychiatry and psychotherapy, because all child psychiatrists also have training in psychotherapy. There is also a European training logbook, but still training in child and adolescent psychiatry and psychotherapy is very different all over Europe. And one of our aims with that seminar is also to contribute to a certain common ground in training. So in Germany, we had a lot of cuts and changes, and the first period was during the 60s and in the year 68. And there was an enquete at the parliament on psychiatry and the large, repressive, huge psychiatric institutions. And there was also rebellion in the streets, and people said that mental problems are common and are normal, and dissolve the institutions. So there was a movement, and there was also criminal cases about maltreatment and even murder of patients in these institutions. So we had a lot of stigma, and people shied back from coming to psychiatry at that time, because many of these people stayed in these institutions for many, many years. And it's only 50 years ago. Yeah, you have to imagine. So it completely changed with the psychiatric reform that the German parliament first advocated. And the first principle was that mentally ill patients are patients like any other patient. So there was an equality between somatic health and mental health. And these hospitals that had been worlds apart had been to be integrated in normal medicine, and psychiatry has to be embedded in the community. And we talked a lot about the personal standards and training standards in psychiatry, and first developments of home treatment and treatment in other settings out of the hospital started at that time in Germany. And then the wall came down, and two systems had to grow together. And you see that the number of child and adolescent psychiatric specialists increased tremendously in Germany after the reunification. And just the diagnostic manuals and the consensus at the world level on the description of the disorders helped us to come together with the colleagues from the East in Germany and the colleagues in the West, and to find a common language. Yeah, and it was necessary to have debates about how we see and how we define psychiatric disorders. And another thing that developed at that time was patient participation and information. And I was at a certain time director of the hospital in Rostock on the Baltic Sea in former Eastern Germany. And we did, in comparison to a Western hospital, a large comparison program on information and patient participation in treatment. And it was completely new at that time. And we learned that patients were informed very much about the rules in the hospital, when they have to come back and things like that. But they were not informed about their treatment. But the fact that we were able to inform them about rules showed that they can listen to our information, and that we should give them information on their situation. So I come to the theme of adverse childhood experiences, the so-called ACEs. And it's a set of abuse settings, emotional abuse, physical abuse, sexual abuse, emotional neglect and physical neglect, and so-called household dysfunctions. For example, mental illness in a household, substance abuse in a household, partner violence, imprisonment of household members, and separation of parents, especially if there is a long ongoing conflict. And this concept to look at all these factors was invented by a professor in internal medicine, Dr. Vincent Felitti, who worked for an insurance company, for Kaiser Permanente, and who wanted to find out why so many of the patients didn't profit from the interventions. And he developed this pyramid that adverse childhood experiences contribute to an impaired neurodevelopment, especially of emotion regulation and action planning and motivation, then lead to social, emotional, and cognitive impairments. Then during youth, adolescence, these people tend to adapt risky health behavior, start with alcohol, with drugs, with nicotine, and then they acquire more somatic and psychiatric illnesses, disabilities, and social issues. And in all statistics, they have a much higher risk of early death. So you have a pyramid, and that's not a definitive risk, a self-fulfilling prophecy. These are statistical risks, but this contributes a lot to the disorders you have in one society. And we made a study in the German population where we had a representative sample of 2,500 persons. We could ask about their childhood experiences, and you see that emotional abuse is very common, 12% of the German population. Sexual abuse is common, 4%. Physical abuse, 9%. Emotional neglect, 13%. Mental illness of a parent, 10%. Domestic violence, 10%. Alcohol use, more than 10%, 15%. And detention of a family member, 3.5%. So you see that all these issues are frequent, but we are made to cope with problems. Yeah. Normally, if we have 1 or 2 or 3 of these situations, we are able to cope with, and children can develop even in a situation of stress. If there is, for example, parental support. And we have seen that, for example, with our young Ukrainian refugees that could come with their mothers to Germany. They had much less problems than unaccompanied minors from other countries. So parents have a lot of regulating role, but if you have a problem in the parental system because of the mental illness or the drug abuse of a parent or because of domestic violence, these kids are much more exposed to the consequences of early adversities. And in the German population, you have 9% of that population that has 4 or more of these adverse childhood experiences. And that is a cutoff that you find in the literature, that if you have 4 and more, you risk to have more severe problems resulting from these consequences of these adverse childhood experiences. And if you look at the following slides, you see that life satisfaction in people with more than 4 of these problems is lower in adulthood. And that's highly significant. But you can see it just by your view. It's like a titration chart. If you have 4 and more of ACEs, you have a much higher risk to develop depression or anxiety, measured here with the PHQ instrument. Or you have a higher risk to get in physical fights with your neighbors, with your friends. You have a much higher risk to humiliate other people in discussions. So it's not astonishing that less of these people are living with their families because they have more intrapersonal conflicts. So it's a very meaningful concept. And Vincent Felitti said, much of what is recognized as common in adult medicine is the result of what is not recognized in childhood. And that underlines why it is so important to look at every child and not only to see the war stress that everybody has more or less at the moment in Ukraine, but also to see these other conditions that contribute to the consequences of stress. Yeah. If we look at prevention and early intervention, we have different concepts. And perhaps you know the classical definitions by Kaplan, where we distinguish primary prevention, so actions that we take to prevent diseases, like the How Are You campaign. Then secondary prevention, where we treat recognized diseases early, and tertiary prevention, where we want to alleviate the consequences of the disorder. Another classification is very important, for example, in drug abuse prevention. That's behavioral prevention that focuses on the behavior of the individual, and situational prevention, meaning making cigarettes more expensive. And this changed completely the age of entrance to smoking in most Western European countries. And the same is true for alcohol use, that is much less common in younger people than in my generation. So the context that the state sets can also contribute to the development of addictions or not. That is situational prevention. But I think the classification of the Institute of Medicine is one of the most important ones, because they come from statistical entities. Universal prevention, meaning prevention that addresses the whole society. And on a universal level, we need in Ukraine, as in all other societies, more mental health awareness, more knowledge about mental disorders, and anti-stigma. Then on a selective level, we have to address the needs of high-risk groups. And the ACEs that I described you are high risks in children. And we have to see the combination of these risks. And this is a target group for selective intervention. And then we have the indicated prevention. These are the children that already come to hospitals. And last week I was in Switzerland and spoke to colleagues from Ukraine that came to Switzerland for a week or so for training. And they told us that they are working in a surgical traumatology hospital to support the children psychologically after an amputation or other horrible things that were caused by the bomb attacks and the drone attacks. So this is indicated prevention. You know that they are high risk because they have that operation, that surgery, and you can support them as early as possible. So we have these different approaches in prevention. And for us as clinicians, this field of selective prevention, indicated prevention, and early intervention at the border of treatment is very, very important. And I think for the community, universal prevention and health education is very important. And so if you are in the participant group, you can look where you can work best in which field to contribute to a better care in Ukraine. And one of the things I talked in Switzerland was that we should apply well-known and well-studied strategies from behavior therapy, from treatment of patients, also in prevention. For example, we did a trauma-focused group intervention for Syrian refugees about 8 years ago, where we trained educators to do a biographical work with them. And the effects of this intervention have been at least as good as individual psychotherapy. So we can really tailor good prevention or indicated prevention or early intervention strategies, not only with doctors and trained psychotherapists, but with well-supervised other volunteers that come from pedagogical professions. And another thing that can be done in school, and tomorrow we will present an expertise of the German National Academy of Sciences on the need of introducing self-regulation as a principle in German education. Because where do children learn to self-regulate after stress, after if something hurts? It starts in kindergarten and then in school. And emotion regulation and defining your aims and really developing motivation, that is something that is learned in school. And that is very effective for mental health. And we will hope that we will be able to convince our politicians to focus more on these self-regulation skills. And this should be a guiding principle in all schools. And we have to integrate that in our common life. So mental health has a lot to do with our normal life situations, and we can contribute a lot to mental health in the functioning of our families and schools and care settings. Yeah, that's one of my main messages. But we also developed quite a lot of computer-based interventions, like that information program for divorced or separated parents and their children, with a children's part and a parent's part. And I think that the internet gives us a lot of possibilities of prevention in that field. And in the classical definition of fility, we have other stressors that are not defined in the Filities 10. But peer violence is one of the most severe adverse experiences of children. Bullying among children, exclusion in the school group, mobbing is an important risk factor. We have meta-analysis, and the programs against bullying are very, very effective. And I think good cooperation and good school climate is very important for mental health and for the coping with the stress of war, to reduce the stress within the groups and to reduce aggression and bullying in schools. So if we come to war, it is clear that war is a horrible childhood experience. And short after the beginning of the war, you see a group from ESCAP wrote a paper on the impact of war and forced displacement on children's mental health. And we also studied in Germany intervention programs for children of soldiers who worry about their parents, and wrote an article on parental military deployment as a risk factor for children's mental health, worldwide meta-analysis. And I think it's also important for you in Ukraine to focus on that specific situation and the risks and how you could cope with these special issues you have to deal with at the moment after the Russian aggression. But the typical thing is you always have something like a pyramid. You start at a basic level with talking about emotions, giving security, then you go to community and family support, then you give focused interventions by group interventions, for example, and then you enter specialized services. So you start at a physiological level where you give safety in a group, even in a situation that is not safe, like in war, that show love and belonging and esteem. So to support the children in a really unsupportable situation. Together with another branch of UNICEF, we are developing an e-learning program, and we did needs assessment in Ukraine with Ukrainian partners, and we are about to develop that program that will be accessible for free for everybody who is working in the field in Ukraine. Then we started for small children that came to Germany, a Huggy Puppy intervention, where there is a small animal that you can take care for, and you ask, the small children ask their puppy in the morning, how are you? And that helps them to speak about emotions. So that was an intervention developed in Israel, and we had it in 2 centers in Germany, at my center in Munich. And it's very easy to implement, and we had really the impression that it works. And then last week in Switzerland, I met colleagues who implemented the WHO Early Adolescent Skills for Emotions program, EASE, and they have a Ukrainian version. And when I finish my talk, I have seen already Mrs. Berg. These colleagues will give us very small presentations of what they have done there, because they have a Ukrainian version, and I think it can be implemented very soon in Ukraine and could be very helpful. So a last point, the digital space as a place of support and a place of stress in childhood. There's a new Lancet paper on public health interventions to address digital determinants of children's health and well-being. And I think in a situation of change, as you have in Ukraine, but also in the complete European situation, we have to have more focus on these digital interventions. And there was recommendations by the WHO on online mental health content for young persons. And we tried to discuss that for the European situation. And if you look at the Lancet paper, you still see that the time spent in social media has an influence on self-esteem, on depression, anxiety, and sleep. And therefore, another paper from the group of Professor P in Austria, in JAMA, shows the depression, anxiety, and sleep problems, and the duration of social media use. And you see odds ratios that are going up, so higher risk for depression with more than 7 hours or 8 hours spent in the internet. At the moment, we are trying to start an intervention in a clinical trial of a social media detox with adolescents to go back to a lower level of using their smartphones. And there is also an attempt, like in the US, the Surgeon General tried to have some sort of a behavioral prevention because he warns on every iPhone package now that there is a risk of misuse and a risk of psychological problems if you use too much social media. We know that a lot of propaganda and a lot of problems that we have in our current discussions come from echo chambers in the internet, where algorithms bring you into a certain bubble that you can't leave again. And a lot of the digital warfare is based on these principles, but there are also informations about self-harm, about eating disorders, and there's a lot of disinformation on mental health, and therefore psychiatrists, psychologists, therapists have to know about these facts, and we have to talk with the companies to develop trusted health ecosystems in the internet. YouTube started in the US, in the UK, and now also in Germany, an intervention in the algorithm to bring certified health information. And we had, during the Corona crisis, the foundation of young psychologists of Crisis Chat that reaches now more than 80,000 youth in Germany with chats about psychological crisis. And they have also a Ukrainian branch and do also chats with people from Ukraine. And you have seen that one of the highest problems in that population was anxiety. So the next course that we are developing in our center is a program on early childhood stress, and perhaps at some time we could translate it in Ukrainian with the new technical means. That's not too difficult, and these e-learning programs are easy to spread out. So I come to the end of my presentation. Prevention of mental health problems is a task for society as a whole, and therefore I'm very glad that you came today from many different fields. We have in some base a general lack of evidence base, but we can use well-established programs from therapeutic interventions to disseminate them as a selective or indicated prevention. The efforts to prevent ACEs are a worthwhile strategy. That's also mentioned in that Lancet paper, that we should focus on these well-known risk situations. We need peer and bystander approaches. We need community approaches. We need family-centered services. And then we need the specialist help for the full-blown disorders. And we have really have a focus on the good side and the negative side of social media use in this context. So with the support of the Danish and German child and adolescent psychiatry societies, we had Ukrainian participants in person at the ESCAP Congress in Copenhagen. And now the German society also contributes to the participation of more than 20 people from Ukraine at the forthcoming Congress next week in Rostock. End of the year, we'll have a psychopharmacology course in Ulm, and I'll also invite specialists from Ukraine to participate. And I hope that we will have the same chance to invite colleagues from the Ukraine to the next ESCAP Congress in Strasbourg. Abstract submission starts now, and I hope to see some of you, if we can also organize it, then in France at that Congress. That's what I wanted to present you. I'm coming from Ulm, and we in Ulm are very proud that Albert Einstein is born in Ulm. He lived there only 6 months, but we know as child psychiatrists that early development is very, very important, and therefore we are very proud about him. Thank you very much for your attention, and if we have 5 or 10 more minutes, I will ask the Swiss colleagues and the Ukrainian friend that works with them to present the EASE program just as an applicable, very good example, and then we will open up for a discussion. Is that okay? Iryna, I only see your face.
Yes, it is. Yes, it is okay.
Так, звісно,
Yes,
можемо.
it is totally
Можемо
okay
зробити.
to- the colleagues
Будь
can-
ласка, представте нам швейцарських колег, і ми маємо таку можливість.
Okay, thank you very much. Can you all hear me?
Yes, we can.
Can you hear me?
Kim, the floor is yours.
Yes, we can.
Okay,
Yes, we can
okay, thanks.
perfectly well.
Let me just share my screen. Good. Can you also see my screen now? Good.
Yes, так.
Perfect. Okay. Exactly. Thank you very much, Professor Fegert, for this opportunity to be able to quickly also present what we are doing in Canton Zurich, and thank you everybody to be here today. Unfortunately, the Ukrainian colleague was not able to join us. She is in the chat, so if you have any questions, you can ask in the chat, and she will answer. She's still stuck on the train, so the truth about Swiss train is not always, it's not always the case. But anyway, I will be talking just really briefly about early adolescent skills for emotion that Professor Fegert already kind of presented shortly. And it's one of the scalable psychological interventions, and it's been developed by the WHO and UNICEF together. This is just a slide to kind of show you how many children we have. It's from the beginning of this year here in Switzerland. So this is throughout Switzerland. And the program you will be hearing about today is implemented just in Canton Zurich at the Psychiatric University Clinic. We already heard today about the stepped care model of the pyramid of the mental health and psychological support. So when the war in Ukraine basically started, we developed for Ukrainian children, adolescents, and their families our own stepped care model within our clinic. And you see the 3 stages on the right side, kind of like a low threshold counseling that is available still either on site or on the phone. Here, families can call, or general physicians can call, schools, psychologists, whoever needs counseling in any sort of way. Then at the stage 2, we have the group prevention program called EASE. And then at the 3rd level, we have the normal psychiatric standard of care. And this, I want to say, this is not a one-way street, right? We can, within our clinic, either send kids to the stage up or to the stage down. So it's not a one-way street. And I think that's really, really important in this setting. So what are scalable psychological interventions? Basically, they're evidence-based programs based on the cognitive behavior therapy, but the way you deliver them is an innovative way. And this is where I want to mention the task-shifted concept. So the way they are delivered is that you either train peers or you train lay therapists, so non-specialists, and they then deliver the intervention themselves. There is a group of scalable psychological interventions. There are 6 that have been developed by the WHO, and EASE is the only one that is for children and adolescents. They are transdiagnostic, meaning that they are applicable to multiple mental health situations. Specifically, EASE has been developed for internalizing symptoms. They are short. EASE is only 10 weeks, and it's a group intervention for adolescents. And what I really want to say here is that they are scalable, meaning that you can quickly train people and spread so that you enable access to the level of care for children that they need. They, of course, do not replace specialist therapy, as we've heard, because they're at that level 2, which is before the specialist care. And here I want to say it's really, really important that they're integrated in existing healthcare systems so that kids who need more can then be, elevated to specialist care. The structure of scalability is what I want to present. We are at the moment training more trainers who then train the helpers or facilitators who are lay therapists, meaning those are not psychologists, not family physicians, but they are people in the community. In our case, you can see the training happened in fall of 2022. We have trained 11 women, Ukrainian women. We have at the moment 3 who are actively delivering interventions. So then you can see at the bottom, they're delivering to beneficiaries. And what is really, really exciting is that the circle doesn't end, right? The circle also goes in the other direction. And Iryna, who is now in the chat, she was trained as a helper, facilitator, so the delivery of the program, and is now today starting with the training to be trainer herself, who can then train other helpers who then deliver the intervention. So this is really where the strengths of these scalable interventions lay. You can, spread them quickly and enable access, and get rid of that stigma of, therapy. So the program was, at the time of the beginning of the war in Ukraine, only delivered in few other countries in low income settings. So it was still in a trial phase. We then had to go through the stage of adaptation to adapt it, not only to translate it, but also to culturally adapt the material. So what is the program? It's basically based on elements of cognitive behavior therapy, and it takes 10 weeks. You have 7 group sessions for basically younger adolescents and adolescents, so between the age of 10 and 15. And additionally, you have 3 group sessions for caregivers. In the case of Ukrainians, those are mostly mothers that are here in Switzerland with their children. The strategies are easy to understand and easy to teach. Like I said, with task shifting of teaching lay therapists who are trained in about 1 week, and then they're weekly supervised as they deliver the intervention. Like I already said, transdiagnostic. Key strategies, anybody who knows cognitive behavior, you are cognitive behavioral therapy, you will recognize it here. Understanding my feelings with the help of the feelings jar. Then another session about how to calm your body once you recognize these difficult feelings. With the help of vicious circles, kids are taught how to change the actions, how to change the vicious circle of action. And then they're taught with the stop, think, and act, managing my problem strategy. Parallel to this, we have, like I said, 3 caregiver sessions where mothers in this case are taught similar strategies of understanding feelings of themselves, but of their children. They're taught the importance and power of praise and also self-care, which is really, really important. Here you can see the original story, which is going through a life of this boy. In original, it was Kian. We've named him Sasha, and we've, like I said, adapted the material. This is the number of groups we ran so far. So about 70 families have gone through the program with us so far. And what is really, really exciting is that since December, the program has also now been officially online in English. It's accessible. We are hoping to be able to publish the Ukrainian and Russian version, which we've translated soon, so it can be also available as an open access, and then we can train also more facilitators to deliver the intervention. This was supposed to be Iryna's part, but as you can see, this is some of the material that we have been using at the sessions, and some of the feedback that we have gotten. This is one boy who didn't really want to participate at the beginning because of, you know, that stigma of psychiatry, psychology, but was then one of the most keen participants of our program. And this was the boy who did not want to go to school because he felt really unaccepted and lonely here. And I think this is really, really powerful. I don't want to go to school because I can't concentrate on my studies. I wear an armor in order to always be ready to protect myself. I'm never relaxed, neither before class, nor during class, nor after or on my way home. Here at the sessions, finally, I felt I could be myself. It was the place I felt safe. No one hurt me, and thus I didn't have to hurt anyone in response. The first time in this last year, I finally felt at home. So, you know, it's more than just teaching children strategy. It's also offering that community of peers, of support in their own language with their own facilitators. This is our team, the three lovely women, Iryna, Anna, and Yaroslava. And then in the back, the three of us, Dominic, me, and Nora as researchers and implementers, and then under the leadership of Susanne Wallica, Nasser Morina, and Christina.
Thank you very much, Tim.
Just some of the photos that I wanted to show from the group, and that's it. If you have any questions, you can always email.
Thank you. So we have time for some questions.
Yeah. Just a sec. We will be on the screen, all of us, hopefully.
Колеги, включайтеся, будь ласка, в кого є бажання поставити запитання, дайте нам сигнал, включіть долоньку. Так, прошу, Альбіна, будь ласка. Звук включіть, Альбіна. А ви підняли долоньку. Так. Добре, не знаю, що ви показуєте нам. Але жестів, але,
якщо не знаю,
будь ласка, хто має питання?
Пані Ірина, ви мене чуєте? Пані Ірина, ви чуєте мене? Пані Ірина, чуєте мене?
Чую, добре чую.
Ага, да. Бачу, що люди питають, чи буде доступний цей запис. Так, цей запис буде доступний. Він буде як на координаційному центрі на Фейсбуці, так і на ЮНІСЕФівських каналах, так і на каналі доктор Булавінова, так і в телеграм-каналах. Тому, колеги, не хвилюйтесь. І питають, як і де можна пройти дане навчання. Пані Ольга Дорош питає, не зовсім зрозуміло, яке саме навчання. Якщо пані Ольга може уточнити в чатику, про яке саме навчання ви питаєте. Якщо про те, де знаходимося ми, то ми будемо робити розсилку, і ви будете приєднуватись. Тому нам цікаво, про що саме ви питали.
Так, у нас буде серія вебінарів. Кожен вебінар буде напередодні анонсований, і ми запрошуємо всіх взяти участь, власне, в цих вебінарах.
І ми бачимо питання до пані Кім Берг. I hear you are collaborating with UNICEF. How would you say other agencies and NGOs could participate, engage, spread materials and contribute in advocacy? So if you, Kim, could respond to this, that would be nice.
Yeah, thank you very much. At the moment, we are not really directly collaborating with UNICEF. You know, this was a program that has been opened to us by the WHO and UNICEF at that time, because it was still in trial phases, like I said, when the war started. So we are implementing the program, but we're not directly collaborating with the UNICEF at the moment. We're implementing their program, but it's not that we are under them at the moment. But I know that they are, you know, there are plans to have this program open access, right? So you can definitely then connect with WHO. I don't know exactly how is going to be implemented, but there are definitely very soon plans to also implement this program.
Так, я дивлюсь, є якесь питання на німецькій мові. Є перевод через Google. Як ви вважаєте, українські діти та молодь повинні залишатися в Україні та стикатись з ракетними обстрілами та щоденними смертями, чи залишатись за кордоном і втрачати коріння з батьківщиною? Я зачитала це питання, бо по-чесному, зачитую всі питання, але мені здається, що воно не стосується теми даного вебінара і більше політичне. Так, багато різних тем в різний час, як знайти, зареєструватись на ці вебінари. Слідкуйте за розсилками і ви будете реєструватися. Якщо ваш емейл був вже в цій розсилці, то ви отримаєте всю інформацію про різні вебінари. Так, анонси, бачу, пані Катерина, ваше питання будуть надсилатись як на електронну почту, так ви можете проактивно дивитись на наших сторінках і в телеграм-каналах. Чи є в когось якісь контентні питання? На якому каналі, знову ж питає пані Зоряна Олексійчук, на якому каналі будуть поетапно повідомляти про серію вебінарів? По-перше, ви будете отримувати це в електронну пошту, це раз. По-друге, на Фейсбуці Координаційного центру будуть обяви про ці вебінари. По-третє, в телеграм-каналі у пані Ірини Mykychak, в моєму телеграм-каналі доктор Булавінова будуть ці повідомлення, тому це не буде проблемою. Питання до наших спікерів. How would you evaluate the need to involve digital IT specialists to promote your work projects and try to streamline this on wider audience and to other countries? This is both, I guess, to Professor Fegert and to Kim Berg. What is the role of IT and promotion in your work?
Perhaps I start to answer. I think that the role of digital means of AI, of chatbots in giving information about psychiatric problems, about emotion regulation can't be overestimated. But it has to be under supervision of specialists. At the moment, what we wrote in that paper on the European situation is that we have a lot of development in the digital field, but it's a bit chaotic and you have very good and very bad information. And on the other side, the clinical field is very traditional, not using the modern digital means. And the young people prefer to get in contact via chat and via all these digital means. And we think we have to bridge that gap. So to integrate parts of digital intervention, of momentary ecological assessments in patients and things like that, digital means in our treatment courses. And we have to supervise and do quality assurance in the digital information and the digital programs that are out on the market, often created on a private base.
Then I will ask one more question. Kim, can you continue answering, and then I will ask one more question on the same topic.
Yeah, I can just echo what Professor Fegert said. Definitely there is a huge potential, I think, but the way we implement it is going to be very important in the future, not only for quality assurance, but also for the risk of data protection. I think that's one thing that we need to still figure out, because mental health is very sensitive data. But the potential is very great, especially, of course, for young people and people on the move, who are being displaced within the country or across the borders. I think absolutely there's great potential.
Then we'll ask one question from myself, because I don't, or just a sec, I will, okay, yeah. So I'll just ask one question from myself, and I guess that will be probably the last one for today, because it's pretty late already in the evening. So how do you see the role of TV series in this topic, in stigma and overall in, you know, kind of giving some hints to the society how to behave with that. Because we see recently on Netflix and on other sources that various complicated topics gets inside in the screenplays of the movies and especially of the TV series. What do you think? Would it be good or not with this topic, or the topic is too sensitive?
I don't think that the topic is too sensitive, but it needs quality productions. So we have some films that really serve the voyeurism of people, and that is creating stigma on mental illness. So this is not good. But there are also projects with everyday embedded evidence-based interventions on adolescents with problems who are hidden champions in certain fields, and showing how they develop and how they find their way. And I think that can be formats that are very, very helpful. But I come back to the same conclusion like for the digital field. Media are powerful, and usually they attract their interest by a certain voyeurism of the audience. And if we really want to reduce stigma, we have to really work very carefully on that and have to have cooperations of specialists with media people.
Kim, would you like to add anything?
No, actually, I think that is a very good conclusion, and I agree absolutely with that. The same as with IT, I think, you know, the quality control and the safety measurements are the most important things.
Thank you. Ми пробули в цьому вебінарі 1 годину і 30 хвилин. Ми всім дуже дякуємо за те, що ви приєднались до нас в вечірній час. І дуже дякуємо за вашу увагу. Вас було дуже багато, тільки в Zoom було людей десь 375 від початку до кінця. І ми вам всім дуже дякуємо за увагу. І ми дуже дякуємо професору Фегерту і доктору Кім Берг за їх участь в цьому вебінарі, також вечірній час в Німеччині. Побачимося скоро, слідкуйте за нашими анонсами, їх ще раз буде багато, як в емейлах, так на сторінках координаційного центру, так і в телеграм-каналі у пані Ірини, в моєму телеграм-каналі і у вас в пошті в розсилках. Тому слідкуйте, реєструйтеся, і записи також є доступними, тому ті, хто не встиг сьогодні, можуть їх додивитись. Дуже всім дякую. Thank you so much, Professor Fegert and Dr. Kim Berg. Thank you.
Danke schön.